when we think about a pandemic, it often requires investment in global public goods. So the question that we're often asking ourselves is, can there be global coordination at a multi-country level and very comprehensive programs around pathogen surveillance? Or even thinking about how we go about establishing, vaccine development and scaling programs. I'm curious about, how the World Bank thinks about focusing on these types of global public goods rather than just a sort of city level, investment, important though that is.
Without a doubt, I agree. In confronting pandemics such as COVID-19, we definitely need global level coordination in the same way that we also need it if we are to take, action to confront the negative effects of climate change. Now, we've been discussing cities, but the World Bank's intervention is very much coordinated at the global level. It's structured around 4 pillars. One is obviously the public health emergency to support countries, supplement PPEs, ventilators, address surges in the cost of delivering such services. The second pillar is the poor and the vulnerable. The World Bank's research has indicated that as many as 100 million could fall into poverty. Another dimension that is of critical intervention that's needed, and obviously the private sector. I mean, we're seeing epic figures in terms of job losses. And obviously, lastly, is thinking about the resilient recovery. All these dimensions require a coordinated and integrated action. An epidemic such as this one has shown that it spares no one. I mean, it hits rich and poor alike. It doesn't matter where you live. Cities are integrated organisms. You might be able to isolate yourself from, other ills of urbanization, like, for instance, crime and violence. You might live in a gated community. Mm-hmm. But the pandemic will make no such distinctions, and therefore the types of action that are needed will need to be coordinated, and you will need to look at cities as weak as the weakest link in there. So in other words, for as long as there are neighborhoods where, housing is in poor conditions, where there are no services, where there is overcrowding, where there are no public spaces, where there is a prevalence of transmission of diseases and pandemics, then it is both an imperative for creating the equitable and inclusive city where no one is left behind.
As weak as the weakest link is a lovely way of putting at it. I think that's the experience within Singapore, for example, where essentially they have hotspots within, migrant worker dormitories, which are very different to the sort of Singapore of the 22nd century, which we often see when we see, movies about the city there. And you've also touched on another aspect, which I think is relevant, which is, of course, cities are they're a highly operant part of people's everyday lives. In a sense, we live in our city more than we live in our nation. That's what we touch every day. But it's also true that we live in our communities and our neighborhoods, perhaps even more than we live in our cities. And that's certainly been the case in the last 8 or 10 weeks in many cities in the West, where we have had real mobility restrictions. I'm curious about the extent to which you think it's important to move closer to communities.
I think this was a transition that was happening in the sense that, the advances in technology allowing you to be able to work from wherever you are with good connectivity, rethinking the future of work, and things such as the gig economy and the sharing economy were getting to be less attached to any given place. If you also look at advances in infrastructure and microgrids, you no longer need to live close to where your work is. You no longer need to live connected to a municipal network. So from my perspective, the real determinant of the city of the future, for me, is all about livability and inclusion. It will be those parameters that will draw you to a city. It will be the quality of life in that city. It will be the diversity of cultural expressions. It'll be the amenities. It'll be the education, and the quality of public spaces, all those variables will be what will tie you to a place or not. And these variables end up becoming much more localized. I mean, we'll want to live into cities that are much more diverse, that are offer you much more possibilities. So, I mean, there's been quite a bit of speculation as to whether, as a result of this crisis, there'll be much more draw towards the suburbs, towards the smaller cities, at the expense of the larger and more dense cities. I don't think that will happen to the extent that these larger and more dense cities are places where there is a high quality of life. There are conditions, for livability and for inclusions and diversity, which are, in my view, the main attributes that will be drawing you to a city.
So that's a zinger of a comment that I didn't expect you to come out with. One of the key questions I suppose people are thinking about is, what are the types of changes that will end up sticking? I mean, I've been very fascinated by this idea of the 15-minute city. Anne Hidalgo, the mayor of Paris, has talked about it, this idea that, you can have all of the amenities, your school, your healthcare, your work, and your family environment, and your friends, within a 15-minute journey of where you currently live. I had the economist Kate Rayworth on this podcast some months ago, and she talked about wanting to try and get everything to within 400 meters. And we've had cities like, New York and Milan talking about setting aside dozens of kilometers or more of roads for cycling and for recreation. Are these the types of changes that you could imagine becoming permanent beyond the pandemic, or will be that inevitable pressure of sort of agglomeration and developing the land take hold?
I think you'll be able to combine the two dimensions, the 15-minute city, cities with increased cycling lanes, with increased and wider sidewalks, with parks and open spaces. I mean, all these are meant to improve the livability and therefore its attractiveness to a population that's otherwise footloose and with technological innovation are no longer bound to live in a given place, to be close to their job. I mean, which is, if you will, the old model of the central business district and how a city is organized. But at the end of the day, I mean, the whole notion of the neighborhood has been, an age-old planning concept. I mean, the notion of that there is an optimal size of a neighborhood. So in this particular case, a neighborhood of like 4,000 to 6,000 people would have enough school-aged children to basically populate the primary school, and then it would have the shopping center and the open space. And that was the unit of planning, since the 1930s. And therefore, you would need just to commute to other places in the city for more specialized services, for that university hospital, for the university itself, for the opera house. So all these elements is a return to an age-old planning concept that was meant to create conditions for livability, but at the same time, the agglomeration and the scale are going to be needed to provide you dimensions in terms of, the city competitiveness, in terms of amenities that draw you into a place. I mean, you're not going to be able to have an opera house in a city of 100,000 people.